Once the list populates, you'll see that you've got a couple different colors. You've got blue, red, and black. Now the ones that we want to focus in on are the blue and red. Blue would be future. It's kind of saying that, hey, if you stay on this path, potentially you could have kind of a severe acute issue in about 2 years. Now, when we're kind of talking about looking for some of those root causes, when we see this pericardium, and it's a 1, so it's a chronic issue, and it was something that happened about 3 years ago, is the way that we would kind of want to look at that. Now, one thing that I would recommend is you take out your notepad and kind of have it in the background, because some of these things, when you find them, you may want to go and just copy and paste these down to your notepad, and I'll show you how to use them a little bit later in another one of those programs. So that way you can do more of a detailed therapy on some of those potential root causes. So I've gone and I've copy and pasted that to my notepad. All right, from there I would go ahead and I can either continue to analyze the database, or I can hit back and I can hit frequency optimization and then do a customized therapy based on the new challenges that we found in the database to go a little bit deeper. Well, with that information that I just recorded, I'm going to show you how to use that in another one of the other tools on the AO Scanner dashboard. I'll see you guys in a minute.